this. We're rocking and rolling, girlies. Welcome. Thank you so much for joining us live, and for everybody that is catching up with the recording. We are back again, which is so amazing, with Dr. Sandar, who is going to be chatting with us this evening about all of the topics that you've brought up through your questions, asking about menopause, perimenopause, and symptoms. And we are going to be also opening up this evening, talking about non-HRT ways of helping ourselves as well. So I'm not going to take over too much. I will ask your questions after we have this kind of brief conversation about this evening's topic. And if you do have any questions in the meantime as well, girlies, jump into the chat. But I'm just going to jump over to Dr. Sandar and say hello. How are you?
Hello, I'm fine, thank you. I have got some questions from Tara, from all of you. So I think we will start answering those questions first, and then I will tell you a little bit about what you can do if you can't take the HRT. Because I see more and more of those ladies, and I do want to explain to them as in, like, not just the HRT, there are other things you can do as well.
Yeah,
Okay,
absolutely.
right.
So I'll get stuck into the questions then. One of the first
Yes.
ones, and some do come up again, so maybe we might overlap on a couple. Does testosterone help with brain fog and memory loss? I've tried the estrogen patches and now the gel and progesterone tablets and a coil. However, nothing seems to change with regard to the brain fog, the loss of mojo and memory. Wondering if testosterone would help, and if yes, what are the downsides to testosterone? Thank you.
Well, the testosterone in women, the evidence is only there for libido. But in men, there are so much evidence for testosterone. And for a man with testosterone deficiency, you would give them testosterone. And there is so much evidence out there about mood improving in the men, and pains getting better, their memories getting better, they are sharper. So there is no reason why these benefits are not going to duplicate for women. It's just that the studies haven't been done for women. But general concept is that yes, the testosterone is not just for libido. It should help with other symptoms as well, mainly the joint pains and the brain fog. People should see a lot of improvement on that as well. So yes, if your estrogen is in a reasonable level, you can check the estradiol levels. And if your estradiol levels are reasonable, and if you are still having issues with the libido, which is what the NICE guidelines say, but other issues like pains, joint pains, and the brain fog, yes, that could be helped by the testosterone as well. The downside of testosterone, if you do it in a responsible manner with a doctor guiding you and checking your blood levels as you should, there shouldn't be a lot of downsides, because we only prescribe low dose for women. A woman is taking only 1/8 of a dose of a man. And you check the blood levels in 6 weeks to make sure that you're not having too much. And you also check the blood levels in about like 3 months' time. After that, if you are quite stable, we don't keep checking it so regularly, but you do keep an eye on it, monitor it regularly. And we do tell the ladies that testosterone may give you hair growth. So try and use the gel in the areas that you don't mind having some hair. You may develop acne, but that is a very rare thing. So if you're doing it with a prescriber who is responsible, I don't see a lot of downsides.
Yeah, of course. That's brilliant. Thank you. And there was another question as well, which said, what are the pros and cons of testosterone? Can it make body hair worse? So this is a natural concern that I think girls would kind of have. Also, can the hormone affect family members? I.e., can it rub off on them, literally and psychologically? So do you find that let's say, I suppose a man and a woman maybe do kind of like in bed or something like that. Are there ever anything where you see that these things kind of like affect other people?
Well, the estrogen gel, I do ask the ladies to put it on and wait for it to dry for about like 5 to 10 minutes. And don't be intimate with your partner for about like 2 hours.
Ah, okay.
Apparently, it doesn't give them a lot of harm, but it affects their sleep.
Ah,
So and we also tell people to not go for swimming, etc. in about like 2 hours as well anyway. So after about like 2 hours, it would have completely sunk into your body and it wouldn't be on your surface anymore. But for it to dry, it only takes about 5-10 minutes. But 2 hours we give it for this to go completely into your system and not left on the body.
interesting. Very interesting. That was a really good question. Next one, how long does it take for the patches to start working? If you find it's not working, is it easy to just switch to a different type of HRT?
Well, not just the patches, any kind of HRT, we do give them up to about 3 months to start seeing the effectiveness of it. The How long does it take for them to start working? It's pretty much the same for a woman to see the benefit from the gel or the patch or the oral medication. And the symptoms, you have about like between 30 to 40 symptoms of menopause. So some of them will get better earlier. Some of them will get better in a few weeks' time. Some of them will take the whole 3 months. So it all depends on what symptoms are actually bothering you, and they will all get better eventually. It's just that it takes a while between each symptom to see a significant benefit.
Yeah.
So yes, from my personal experience of me using the HRT and also treating the patients, a lot of people start seeing some sort of difference within about 2 weeks. It's just that it is not going to be like all of the symptoms going away.
Right.
In 2 weeks, you might feel like your flushes and your heat sensation is not as bad. And then you find like, oh, your sleep is a bit better, your joint pains are going. And then it takes about like 3 months for brain fog, etc., to show significant difference. And the effects keep on ongoing and getting better.
Yeah. Yeah. Excellent. Fab. Thank you so
And
much.
yes, and you can change it to another HRT, but I would say give it about like 3 months to see the full effectiveness of it.
Yes, you're not rushing. Excellent, Brill. Thank you. Okay, next one. As I never had HRT, I'm now 62. I've started taking calcium with vitamin D. Is this something you would recommend? I also take magnesium. Should I be taking any other supplements?
Calcium vitamin D is always good for a postmenopausal woman because our bones will start to become brittle. And especially if this lady hasn't taken any HRT before, her bones would have actually come a bit brittle unless she is like a very good person who does weight bearing exercise and drink plenty of milk and little fishes, etc. So yes, calcium vitamin D is something that we would recommend for all the postmenopausal women. Magnesium helps in calcium absorption. But rather than taking like different minerals, like every single one, you could just go for one multivitamin and minerals which is suitable for postmenopausal women. That would be fine as well.
Yeah,
Because
brilliant.
I know how hard it is to take like 15 supplements.
Oh my word, I know you'd be rattling around you would in the morning after all of that.
Yes.
Excellent, thank you. We have had a question as well. Will you be hosting another session at 1192 anytime soon? Because I took away a lot of information from the last event. I think that's going to be a big yes.
Yes, we will. I think this one we're going to focus on weight.
Yep, excellent. I'll be there. I will. Looking forward to it as well.
Okay.
It's always good to actually see some faces and share
Yeah.
inspiration for sure. So we will be getting another one, absolutely. And have a listen out for when the next date is. Okay, so next one. Is it common to feel insecure with low self-esteem and low self-worth during the perimenopause?
It is. You not Some of it is mental. Yes, you actually feel insecure, low confidence, and feeling upset easily, or you get irritated easily. It's all because your hormones are going up and down, and you are becoming more sensitive. And some of it is because of the physical symptoms as well. You know, if you're feeling like achy all the time, and if you keep on forgetting things, and if you're not up to your usual self, you suddenly doubt yourself. You think like, am I still good enough? What if I'm not doing it right? So it's all a combination. So yes, it is very common thing to be feeling like that. The important thing is to recognize that you are feeling it, and you would do something about it.
Yeah, absolutely. Brilliant advice. Thank you. Next one, can hormonal changes cause plantar fasciitis? And if so, is there evidence that HRT can help with plantar fasciitis?
Well, menopause gives you pains all over. It could be because of the muscles, it could be because of the bones, it could be because of the ligaments. So, in general, I think any aches and pains can be responsible by the menopause.
Yeah,
And the estrogen is involved in cellular level. It is involved in your mitochondria, which are like the little battery cells of your cells. So if mitochondria don't have enough estrogen, your cells are not strong enough, and literally any part of your body can hurt.
yeah.
But I think plantar fasciitis is also related to the activity that you do with your feet. So you might want to look into like, what am I doing all day long? You can do exercises to strengthen and make the plantar fascia more flexible. You could actually wear a footwear with really nice cushion in them, rest. So it would be a combination of both the physical part of it and the menopause. But yes, menopause can give you pain anyway.
Oh my word, absolutely. Okay, we've got two more, quite long ones. So, if you have perimenopause symptoms, but there is no test for perimenopause because of your hormones fluctuating, can there be any adverse effects from having HRT if your estrogen hasn't gone down enough, if that makes sense? So, I suppose the question here is, could you be too premature in taking estrogen and then you end up having too much estrogen?
Well, if somebody comes in and tell us doctors that I think I am perimenopausal, we would be asking the right questions of the symptoms that you would have in perimenopause, which is basically the same as the symptoms of menopause. They may be as severe or less severe, and there is a questionnaire that you can fill in, which is called Green Climatric Scale. So you could be filling in those things or answering these questions, and if you're ticking a lot of the boxes, it would be menopause, and these symptoms are happening only because your estrogen goes down.
Yeah,
So if they wouldn't be happening if your estrogen levels are up there somewhere.
yeah.
So there shouldn't be any downside of starting an HRT, and you wouldn't be started on a very high dose either. The standard dose you would start for any woman from 40 to 55 years of age around would be like an estrogen 50, which is a 50 patch, or 2 pumps of an estrogen gel. None of that would give you too much estrogen. The only thing is that around that time, you still will have to think about contraception. So this is the kind of HRT you would have a proper discussion with your doctor, and ideally you would want a form of HRT where the contraception is already incorporated rather than extra. Because if you have to take extra, you do have more hormones then.
Yeah, of course. Brilliant. Lovely. Thank you. And the last one, I've been experiencing some symptoms, but not the usual kind you associate with menopause. I'm 46, not on any contraception, and I haven't been for a long time. I have regular periods, but they are very heavy that my doctor said they were probably due to fibroids. A week prior to my period, I get very snappy, irritable, mood is very low, and self worth is very low. I get extremely anxious and emotional. It reminds me of when I was pregnant, very similar symptoms. In addition to this, I have brain fog, completely forgetting names of items. I also have very achy, sore wrists. So, my question is, could this be perimenopause? Should I see my doctor about it? I sleep very well. I don't have the hot flushes. In fact, I'm more of a freezer. I'm cold almost all the time when everyone else is boiling. Are there certain types of HRT for different symptoms? I can cope with most of the symptoms apart from the very low mood as it affects the rest of my family. So probably something that a lot will kind of resonate with as well, that, you know, it may not necessarily be the typical symptoms of brain fog and things, and quite the opposite with, instead of heat surges, that, you know, being a freezer. So what would be your advice on this one?
But this lady, her problem sounds like we used to call it premenstrual syndrome, but the new diagnosis that is used more these days is called PMDD. It's a premenstrual body dysmorphic disorder. Basically, near your period time, your body start to feel different things, and you feel different. You actually think that your body is different. So that could be because the hormones changed. Around that time, your estrogen goes down, your progesterone comes up. So that might be what she's feeling. And usually, depending on the patient age, you could either be taking contraceptive pills to keep the hormone levels completely stable, not going up and down, or you could be using kind of HRT. So yes, speaking to a doctor would help. And there are some other things that the doctor might suggest, like checking the blood for thyroid, because thyroid can make you feel like a freezer, and it can give you heavier periods as well. Fibroids possibility, if there is an ultrasound available, you could check it, because with somebody with fibroids, you want to choose your HRT carefully so that the HRT doesn't make the fibroid grow more. So yes, do see a doctor, and there are ways you can tackle this, and you will feel better.
Oh, brilliant. Thank you. And I think that important part that you said at the end then is you will feel better, is having that belief that, you know, things can be better. We just got to make sure that we seek that advice and take it from there. That's amazing. Well, that is the questions. So that does bring us on to the topic that you wanted to chat about this evening. So
Yeah.
I'm going to hand over to you.
Yes. Well, the reason I wanted to let women know is that I hope that you guys are aware about the new drug that comes out with the approval. It is for mainly for the flushes and heat sensation. When when we say hot flushes, it actually means both words. You could be just hot and not having the flushes, or you could be having the flushes but you're not very hot, or you could just be sweating. So for all these people, we haven't got very good medication up until now. We used to take something called clonidine, and the clonidine works for some people, but not for some. So we do give the clonidine to the lady, and you have to take it up to about like 2 tablets 3 times a day, which is a pretty high dose. And you have to keep an eye on the blood pressure as well, because it used to be a blood pressure medication. So that was as far as we got when it comes to hot flushes before. But now we have got a new drug called Biosa. It's still not on the NHS, but it's actually not very expensive if you have to get it privately. And what it does is it blocks the other hormone that give you the heat sensation or the flushes. So it doesn't really do anything for the estrogen, but the flushes are happening because of the imbalance between that estrogen and the other chemical messenger called a neurokinin. So that they block the other one, and that way you're not physically doing the hot and the flushes and the sweating, because for some women that is a problem. It because they might be in the middle of a meeting or something, and you suddenly become very very hot, you suddenly sweat, and then you forget things that you're going to say. That can be very very upsetting, and that can affect your self-confidence, that will affect your performance. So there is a new drug coming out which actually helps, so that's something you can think about. And also the nice guidelines are advocating the cognitive behavioral therapy for two symptoms of menopause. when this came out, people were getting very upset because they think that NICE was saying that menopause is just all in the head and you just need a CBT and you don't need an HRT. That's not what they're saying. What they're saying is that some of the symptoms can be helped with cognitive behavioral therapy. And the heat sensation and the flushes are one of them which you can use the CBT very well. What happened is in the menopause, because of the imbalance between the estrogen and that neurokinin, your body's thermoneutral zone become very narrow. So you have a thermoneutral zone where you don't feel cold or hot. And until menopause, that zone is like this much. When it comes to menopause, because of the imbalance of these two, you become this much. So in the past, if you were here, you wouldn't have been hot. If you were here, you wouldn't have been cold. But now that it become very narrow, you feel these a lot more. So if you understand that thermoneutral zone a little bit better, your acceptance of this symptom would be a little bit better as well, because these hot sensation flushes, they actually don't last all day long. They go, and you know that they go because you had them before.
Yeah.
They're not there all the time anyway. So you could actually tell yourself that they go. I know that they do go. And what other thing you could tell yourself is like your body tends to emphasize on the negatives. Your body might tell you like, that's it, that's going to happen for the rest of your life. You are never going to get out of these things, and then you won't be able to go into these important meetings or gatherings because you don't know when this is going to happen, and you're going to have to run out, and then this might make you isolate yourself more, which basically makes you a lot more sad, and more stress actually make more menopause symptoms. So you just keep going into this cycle, but you can break that cycle in every step. You could actually ask yourself like, okay, what am I thinking now? Am I thinking rationally, as in this thing is going to go in 5 minutes because that's what they usually do? And what usually helps? Having like cold drinks help. Having a little fan with you, which you could just use it even without other people knowing helps. Or just putting your head outside of the window helps. So do I have all these little things ready so I can make this go quicker? Or what's the worst that could happen? There are studies where like thousands of women and men were asked, what do you think when you see a woman who is having a hot flash? And a lot of people don't think anything. They were actually too busy yet thinking about themselves.
Yeah.
And some people would actually feel like, oh, I might think that, oh, she might be feeling ill, or I might try to help her. Or someone think that, oh, this lady might have flushes, she might be in menopause. If she needs help, I will help her. So nobody is actually thinking that this person is stupid. Nobody thinks that something horrible is going on because of this woman's fault. So we tend to make these things bigger in our head. So the CBT basically try to train you, as in like, what am I thinking? Is my thinking actually helpful? If it is not helpful, how can I reframe my thinking into a helpful scenario? What is the endpoint I want? What can I do to make this endpoint quicker? And what is the worst case scenario? Has that worst case scenario ever happened? Because some women think that, some people think that I'm stupid or I might lose my job. Has it happened? It hasn't in most of the scenarios. So these are the kinds of principles of CBT that you can use for hot flashes. And it's easy for me to talk about it, but that's because I've actually tried it for many, many months. I studied it, I tried it. So you don't get it right all the time. You just keep on trying. In every little step, what do I do when I get a hot flash? Do I go and shout at my husband? Or do I tell him to get out of the room because I need to open the window and etc. etc. So what happened? Can I make this a little bit better? So those are the things that you could try and reframe it for yourself. Another thing is sleep. The menopause sleep problems are like nothing else. It's basically you just don't want to sleep and you are just awake. And then what usually happens in our heads is like, if I don't sleep tonight, I'm going to be rubbish tomorrow. I'm going to be sleepy all afternoon tomorrow. And then people will think that I am rubbish and I'm going to forget things more, etc., etc. You keep thinking in that direction. You just need to remind yourself as in, is this thinking actually helpful? What can actually help? Have I tried like relaxation music kind of things? Have I tried to explain to myself that it is not that bad that if I don't get 8 hours sleep? Because actually in science, not everybody needs 8 hours sleep. 3 or 4 hours sleep is actually quite good enough for you to function tomorrow. So this isn't actually that bad. And rather than doing more of the negative thoughts and doing the activities like watching more TV, etc., would actually make you sleep less. So you might want to start finding out activities that will calm your brain more and get back to sleep. And there are natural things that you can take, like melatonin and other lavender stuff and everything. So just keep trying whatever that works that will make life a bit better. So all of that you can try in like CBT sessions. The CBT sessions can be group therapy, or you could be having a one-to-one with a therapist. And usually you talk about your personal circumstances and you actually make concrete plans. Until you make concrete plans, until you actually write down one night where you have hot flashes or inability to sleep, you actually write down, what was I thinking? What do I do after that? How did that actually affect me? And then you analyze it with someone like, okay, so this was helpful. Let's do more of that. This wasn't helpful. Can we do something else instead? So that's the kind of exercise that you do with a CBT therapist. And you usually need to do about like 6 sessions so that you know what you're going to do. And then you keep on doing it for the rest of your life, basically. Once you get the hang of it, you will be able to use it in other things in your life, anything that doesn't go your way. So that's the kind of thing I wanted to explain tonight. So if anybody is having those symptoms and you can't have HRT, there are other drugs. I have only talked about Bioza, which is for the hot flushes. But there are other drugs, like if you're having pain, you could have other medication that helps with the pain, especially for menopause. If you are feeling depressed or anxious, there are antidepressants, anti-anxiety medications that have proven benefit in menopause. So you're not missing out just because you can't have HRT. There are other ways of tackling menopause as well. But yes, HRT is gold standard, but some people just can't have it.
Yeah. Yeah. That's
Okay, that's
brilliant.
all I wanted to share
Oh,
tonight.
amazing. Thank you so much. And, we can see how important it is for us to develop skills and keep on doing the reps. Just the same as we've got to do a workout, the power of our thoughts and, as you mentioned there, reframing is just the number one thing, isn't it? Of just managing every kind of chapter of our lives, really. So important stuff. And thank you so much. And I know you can, help a lot with all of this. If anybody wanted to reach out to you for some help, what is the best way that they can find them? Either the girls that are here live this evening or catching up with the podcast.
I have clinics in Santa Maria. I do that on Friday evenings at 7 to 9. I was only doing it twice a month, but now I have increased it to every week now. So I could actually have more appointments, otherwise, people don't have appointments. And I'm going to start on Thursday mornings in SA1 practice where I'm going to get a room so I could see a bit more people because I have more ladies who want to talk about HRT. They also wanted to have these CBT sessions. So yeah, so the two main clinics I got are the 1192. I have them on Saturday mornings, but 1192 I do more of the aesthetic stuff. We can still do the consultation if the ladies are only available on the Saturday morning for menopause, CBT, etc. But I use most of my 1192 appointments for aesthetic. Santa Maria and the SA1, which are Friday evening and Thursday mornings, are the ones I do more of the consultations. They could reach me through. I have got my a website. They can look me up on the website, or there is a top doctors website as well. They got me on there as well, so they can contact top doctors where they would make appointments for the patients as well.
Brilliant, lovely, thank you. And what I'll do is I'll link those as well with the recording too, so people can just tap the link on there. Well, I always learning something from you. I've picked up so much myself this evening, and you feel like you know so much, and like, oh, I know enough now, and then you're like, oh my gosh, I didn't know that, and always something brilliant that.
Well, I am always learning something new,
Yeah,
because when I first started having menopause, that was many years ago now. I didn't know that this was menopause, so it took me a long time. And then during that time, I have tried different drugs. And then even when I knew I am in menopause and I started HRT, it was very hard to find the one that agrees with me.
yeah,
So that's where I started taking a diploma course for CPT. And I have tried to learn everything so I could help myself and help other people. The
yeah.
aesthetic was also because of that, because menopause comes with changing in your body, your weight change, your face change. Anything that would help people get back their confidence is something we should all be looking at.
Yeah, absolutely, absolutely. I wanted to mention as well a little comment from one of the girls. It's not a question, but more a reflection from a previous session. I've completed my last session tonight at 1192 Clinic for the Tesla chair for urinary incontinence and urgency. It's been a game changer. It was lovely to catch up with Dr. Sander for some menopause advice, and would highly recommend it. And I will
That's great.
second that
Thank
as well,
you.
because myself, I've been on that chair, and well, the only thing I can really compare, I went to a concert in March, I couldn't jump up and down dancing. I went in November and I could jump up and down dancing. So, it's really important that we can do these things. We've got the links there as well, which I'm going to make sure that I save both of those now and pop them into the notes. And yeah, thank you so much for this evening and chatting with us. And we'll always be excited to welcome you back again. I hope that everybody has picked up so much from this evening, and it will be recorded. You can listen back if you missed anything, and of course catch up with Dr. Sandar with the links as well that have been tagged there.
Yeah,
So
we'll do the session in 1192 for weight. If everyone could come, that'd be great, because you don't have to be super weight to look about and look after your health and keep your shape. It would be useful for everyone.
absolutely brilliant stuff. Lovely. Thank you so much. Thank you, everybody. Enjoy the rest of your evening, and I'll catch up soon, and I'll let you all know when the recording is out. Have a good evening,
Thank
guys.
you all very much.
Thank
Bye
you.
bye.
Bye.